Mushfiq, I was hoping we could move to you and you could tell us about the work that you are doing with Government of Bangladesh and A2I to combine various data sources. And tell us both about the methods themselves and also why you think they hold so much promise in this moment of COVID.
Yeah, thank you, Maria, and thanks everybody for participating, especially those in Dhaka joining in. I know many of you are, it's right after Iftar and maybe before prayers, and thank you for spending your time with us. And you know, the problem we have right now, as already was clear from Anirbhai's comments, it's a very, very complex problem. Because, you know, you have new categories of poor who are coming up. People, like, we have to really both do vertical and horizontal expansion of our system, where we, you know, bring in more and more people into the relief system. And, you know, we've had lots of, in the newspapers, you see lots of discussion and debate around social distancing, should we be opening factories or not, etc. Right? And I have to say, the panelists on this, in this room right now, so Asif Bhai, Anir Bhai, and I all probably have slightly different views on the extent of social distancing we should pursue. But one thing that we don't disagree on, in spite of the fact that we disagree on a lot of other things, is that we need to get relief in the hands of poor people very, very quickly. People are hurting and they need support, right? And this is not a uniquely Bangladeshi problem. We are, you know, the methods I'll talk about, we are also working with the government of Nigeria, where partly because of the oil crisis, you know, it's even more of a problem there. And they're already seeing sort of civil conflicts emerging. And you're also seeing protests emerging in Bangladesh. So it's important that we get this right. And to handle that complexity, I think we do need to bring in multiple methods and sources, right, to do as best as we can. And before I describe the method, I should say, look, we have to also acknowledge the fact that everybody's uncertain about things. This is a new crisis. This is a complex problem, right? So whatever we do, we might not get it perfect. Right? And part of the reason for us to hold this webinar right now and maybe have more conversations over the next month is that we do want to engage with the citizens of our country. We want to engage with other experts from different fields. We want to get feedback, and we want to make sure that we use all of the ideas that are on the table. We check all the boxes that people may be concerned about. Okay, so with that said, so let's, I mean, the first step, I think, in thinking about relief distribution, we have to first think about exactly who should we be targeting. And that's where some research, some data, some expertise can help, right? So Anibhai already pointed out, you know, there are traditional poor people. There are poor, ultra poor, Duridro, Hotoduridro. We have to be targeting them. We have to help them, right? And an important reason is that, look, if you don't help them, they're not, even if you want to impose social distancing, they're not going to be able to maintain your guidelines if their children are going hungry, right? And another category that Anirbhai mentioned that's a little bit more difficult is the new poor, so people who are suffering the most during this crisis period, right? So this is separate from poor. This is who are the people who face the largest shocks, largest decrease in their income earning opportunities, right? And yet another group that Anirbhai's comments alluded to are people who are moving around, right? So urban laborers, right? And that's a uniquely important group because we know how the virus spreads. It spreads from human to human transmission, right? And we already have data that shows that communities where there are recent migrant returnees, right? They're 2.5 times as likely to report in our surveys that they have COVID symptoms, right? We also see, you know, the quarantines, the distress calls, the testing that we're seeing not only in Bangladesh but in other countries, in Philippines, in Indonesia. You know, it correlates quite well with migrants moving around, and that means we have to be very careful about the fact that these are people who might be spreading the disease, and therefore we might want to target them and make sure that they don't move around, that they're not as desperate to move around, things like migrant laborers. So part of actually what we are able to offer through data and analysis is pretty simple. We just think through conceptually who should be targeted, and also use our data that we are collecting right now through phone surveys, as well as data that we have from the past few years on occupations, to just help us think carefully through, these are the high, you know, target groups that should be prioritized, right? And then now getting into the complexity, okay, that, okay, how do we identify people who are in these groups, right? Because they're new, it's not that we have existing databases. And again, that's a problem that's not unique to Bangladesh, right? Many low and middle income countries don't have the existing infrastructure present. Yeah? And so to do that, like the trick that, the insight that we are trying to make use of is that while the government doesn't have complete information about who falls in these groups, researchers don't either, BRAC doesn't either, right? There's one technology that people do carry around in their pocket that's closest to being universal in Bangladesh, and these are mobile phones, right? And so here I have to give credit to the mobile service providers in Bangladesh. They're very technically very sophisticated. So we've learned a lot in the past few weeks around the sophistication of Robi, around Grameenphone, Banglalink, and they've already been cooperating with the government to provide very, very useful data, information, and services that we need for this crisis, right? And so if we get to cooperate with them, then maybe we can get information about who's where and what they're doing. And how is that useful? So, well, the simple way to explain this is that, researchers like me, we've been collecting lots of survey data in the past few years. So for a subsample of people, small pockets of people in many different upajilas around the country, we have very good information on who are the poor, who are the non-poor, right? Who are the people who are in occupations that we should be targeting, that are more deserving of support right now versus not, right? So we have this information. Now, if we can merge this information with the really impressive data that telcos have maintained databases, right? Then what you can do is look at how are the cell phone usage patterns of the poor and the non-poor different, right? Are there usage patterns that distinguishes one group from the other, right? And there might be very subtle differences in usage pattern. It won't surprise any of you to know. So the people who are logging in to watch this, right? We are all in a relatively privileged position, right? And we probably use our cell phones differently than poor people do. So you can imagine how much SMS we send versus calls we make, right? How many people we call, right? How big our network is, right? All of those things are very, very different for poor and non-poor, right? And so the idea here, and we are trying to use the state-of-the-art technologies that have been developed around the world and published in in universities like Harvard, Yale, Stanford, UC Berkeley, and then published in the top scientific journals in the world, right? To try and create a system where we identify using the telco's impressive data sets, can we indirectly infer who is likely to be hurting during this time based on their cell phone usage pattern? Okay, because if you can develop that algorithm, if you can develop the matching process, then you can easily apply it, maybe not easily, but you can apply it to the entire population who have cell phone services. Now, the final thing I'll say is that this procedure has a lot of advantages, right? Traditional ways of targeting are slow because you need to create lists, you need to have interviews, you need to do surveys, right? And we don't have the luxury of being slow right now. Given how fast the virus moves, we need to move fast as well, right? And it also has advantages in terms of being low cost. So if it turns out that 100 million or more people have cell phones, then we can use the cell phone based strategy, right? Then we can quickly reach lots and lots of people, right? And we can do it at low cost rather than doing many surveys, right? And asking many questions and deploying many people around the country, right? And especially during a social distancing period, that's important. But it also has disadvantages, right? So for example, we cannot just leave it up to a model or a machine to make all these decisions for us, right? The machine is going to make mistakes, just like humans make mistakes, right? There's going to be what we call inclusion errors. People who shouldn't get support, maybe their names will come up. Exclusion errors, even more important, people who should receive support, maybe we're not identifying them, right? And so it's important for us to not just leave it up to the machine, but to develop an amalgam system where we also have human touches. So here's a simple example. So the machine can tell us, oh no, here are the people who are very high likelihood of support, almost definitely need support. Here are people who have medium likelihood of support, right? So for the medium likelihood, we don't want to just say, okay, let's not go there. Maybe what we should do then is send out an SMS. So these are the technical capacities, thankfully, that A2I, Anirbai and his team have developed, and BRAC also can deploy, right? We will send out SMS messages and ask people saying, it looks like you might need support based on what we know, right? And can you answer these 3 questions on SMS, right? Or call this number. because we want to bring in the human touch and make sure that we fill in the gaps that are being missed. Right? I think ultimately it will have to be a system where we make use of all different sources of information, both human as well as modeling.
Great. Thank you, Mushfiq.